TimesOfIndia.com's digital conclave on National Doctors' Day, a tribute to the torchbearers of our health. I am Dr. Ananya Avasthi, your moderator for this session. As a quick introduction, I'm a public health practitioner with a master's in global health from Harvard University. My background is in policy consulting, and currently I lead an organization called Anuvad Solutions that works on translating science to inform policy action on India's health and nutrition agenda. Today, we gather to acknowledge and pay tribute to the extraordinary doctors who not only hold the power to heal, but are the pillars of our healthcare system. On this special occasion, we unite doctors from various disciplines and even policymakers to share their insights on a range of topics. Now, talking about this particular session, we are convening here to shed light on a very critical issue that has plagued the healthcare sector in India, and we particularly saw a rising trend during COVID-19, which is violence against doctors. The rising incidents of physical and verbal assaults on our frontline healthcare professionals have reached alarming levels, posing a big threat to both their safety and even quality of patient care. In this session, titled Violence Against Doctors, Ways to Weed Out the Social Menace, we will explore the multifaceted nature of violence against doctors, examining its root causes, its impact on not just medical professionals, but also patients and healthcare system as a whole. With that, let me get started with panelist introductions. First, we have with us Dr. Kumar AGARWAL, National President, Indian Medical Association. He is the Council Member, World Medical Association, is Head National Program, IMA, ICB, UNESCO, Chair Bioethics National Program. He is also the ex officio member of the National Board of Examination and invited board member of National Accreditation Board of Hospitals, also known as NABH. Dr. AGARWAL was former National Chairman of IMA Hospital, was National Senior Vice President IMA Headquarters, was State President IMA UP State and State Secretary as well. Thank you, Dr. AGARWAL, for joining us. Then we have with us Dr. Vinay Kumar, President, Resident Doctors Association of AIIMS, Delhi. He is currently President, Resident Doctors Association and also Chief Coordinator of MBBS Batch. He's ex-President RDA LLRM Medical College Meerut, also ex-President RDA Uttar Pradesh. He received Chikitsa Seva Ratna Award by Delhi Assembly. He is also the national convener of Federation of Resident Doctors Association. Thank you, Dr. Kumar.
Thank you.
Now we have with us Dr. Rohan Krishnan, President, Federation of All India Medical Association. He is Fellow NHS Hospital, King's College, London. Dr. Krishnan is the Chairman and past National President of Federation of All India Medical Association, which is an organization of youth doctors, which has more than 1 lakh members. He is the founder of the organization and director of Dr. Rohan Krishnan Healthcare and Educational Trust. He is a well-known medico-social activist and has worked as the President of the Resident Doctors Association of PGI, President of Students Union of Rajiv Gandhi University, Karnataka. Thank you, Dr. Krishnan. And
Thank you.
Finally, we have with us Dr. Aviral Mathur, President, Federation of Resident Doctors Association, India. He is the National President, FODA, and also President of Resident Doctor Association, MAMSI and Lok Nayak Hospital. He received WHO Award for Excellence in Healthcare Activism, COVID Warrior Award by Government of Delhi. He's also received Delhi Medical Association Distinguished Service by a Young Doctor Award. He's instructor with American Heart Association Certified BLS ACLS and member of Airway Management Foundation India. So with our smart panelists, let us get started. My first question to you, Dr. SHARAD AGARWAL, starting with the context to the session, violence against doctors. Break this down for us. What does it really mean? And do you want to also add some context on what we saw during COVID-19 and whether this entire topic, this entire issue of violence against doctors got more prominence and got more center stage due to COVID-19?
First of all, thank you for touching the important topic on the celebration of Doctors' Day. Violence is the biggest problem, and any kind of violence, like damage to the property, to the establishment, or the hospital, or the manhandling, and the physical violence. And sometimes it leads to the death also. Like you see that last month in the Kerala state, one resident doctor who was just 22-year-old, a young lady doctor, she was stabbed to murdered while she was on duty in the presence of police. So this is it is very sad to say that India probably the only country where these kind of violence are increasing day by day and are acceptable, and there is no action taken by the government or the society. Hospital IMA is demanding for years that hospital should be declared the safe zone, like in the war situation. Even in the war situation, the hospitals are declared as a safe zone. Because see, the impact of violence is if the doctors will work under pressure, they are dealing with the critical situations and they have to take the decision instantly when they are dealing with the critical situation or the emergency. God forbid if they were under pressure and if they are in the dual thinking, and whether I will take this decision or not, if something happened to the patient or there is any untoward effect or untoward outcome, then there will be a violence. So they will be hesitating and they will not be able to take the right decision, and which many a time save the life. So it should be definitely condemned. The society first to be sensitized, and definitely media can help us in a huge manner, huge way, because media can make the society understand then doctors cannot be compared with the other profession. It is not like that you are paying and getting the service, and if you are not getting your outcome rightly as per the desired, you are going to do the violence. And even if you have any complaint, I am not saying that they are 100% the thing. Even if you have a complaint, there are the code. You cannot take law and order in your hand. You can. There are appellate body. You can complain against that. But and in any situation, any kind of thing, or even the untoward outcome, violence is not acceptable. And violence is moreover on the, you see recently, there are violence on our young doctors, resident doctors, when they are doing duty in emergency. And you know, the situation in India, our young doctor who are posted in the emergency, the post-graduation doctor or the interns, they are doing 36-hour, 48-hour continuous duty when they are on the emergency duty. And the number of patients they see in a single duty is in hundreds, more than hundreds. So can you understand the situation of those young doctors who are continuously working, and then there is no security to even in the government hospital. So this is a very sad situation, and we are demanding with the government for a central act. Like you said, that what is how we see in the COVID. See, in the COVID, during COVID, there was an ordinance brought by the central government that is only for the pandemic situation. The government brought an ordinance, and by that ordinance, any kind of violence on the doctors or the healthcare workers is a punishable offense. Why can't central government extend that ordinance, making a law and a fresh act, central act? I don't understand. See, both the situation are same as per as the medical perspective. For the government perspective, it could be a different that was the pandemic and now it is a normal situation. But believe me, the young 3 doctors are there in the panel. For doctors, when they work in the emergency, patient is patient. Whether it is a patient of COVID or any respiratory infection or even a trauma, we deal the patient as a patient according to their disease element and give our best to save the life. So these situations are different for government but not for the doctors. And believe me, we have lost our 2,000 doctors and more than 1,000 healthcare workers while serving the COVID. So it is a very, very unfortunate situation. Government should immediately make a central act against the violence, any kind of violence in the hospital with the healthcare worker and with the doctors.
Great. No, very, very thankful so that you've set up the context very well. And as you said, media can play a big role, and I'm sure digital conclaves like this by Times of India, I think initiatives in that direction so that there is greater awareness about this Talking about the impact of violence, Doctor, my next question is to Dr. Krishnan. How does violence against doctors impact their own physical and mental well-being at an individual level? Dr. Sharad gave us a big picture, but what does a doctor who's on a receiving end go through? You're on mute.
If you see at individual doctors level, both the physical as well as mental trauma which is there to the doctors in regarding with the violence is pretty much. You see, when you join MBBS, you are of the stage when you think that doctor Bhagwan ka roop hota hai. That was the perspective that was given to all those people who aspire to go into healthcare structure, who becomes a medico. But later on in their life, as they grow, they understand that the mindset of the public has changed, and it has now become ki doctor chor hai, shaitan hai, and the public of the country is not able to accept the changes which has happened in the medical field. Earlier, the doctors used to see the pulse and write the prescription. Nowadays, we have more modalities where we can do various kinds of investigations, where we can treat according to the cause. The life expectancy has increased from 35 years to 70 years, is all because of these development in the medical sciences. But the public is not ready to accept this. As a result, what happens is that the doctors face the blunt of this unacceptance by the community. Now you see, for someone, if any XYZ person is getting some kind of is going through some kind of violence, the other fellows who are working in the hospital, the other fellows who are working in the state government and other hospitals, they get some kind of fear. They get fear for themselves. And also you see that majorly doctors are couple doctors, two doctors working together and running a small hospital. So they fear for their spouses, they fear for their husbands and wives as well. So there is a lot of stress, anxiety and mental tension among the doctors. I like to bring up some data. If you see that around 64 MBBS students have suicided in the past 5 years, and around 155 postgraduate students have committed suicide in last 5 years. I think that this is a very huge number if you come to see to it. And according to the data available by the National Medical Commission in an RTI, around 1166 MD/MS students have taken out their admission. They have dropped out. So it means that it is a huge number. 1100 students who have qualified for the postgraduate examination, which is one of the toughest examination of the medical community. It is like cracking a UPSC for us. And if so many students are dropping out, there has to be some alarming situation. And this alarming situation is the depression, the anxiety that the doctors are facing on a day-to-day basis. Around 75% of the doctors, mind you, madam, 75% is a very huge number. 75% of the doctors have faced some kind of violence in their workplace in the country. This is a data which is legit by the Indian Medical Association. So when we are saying this, it means that there are a lot of stress. Even if someone is not gone through, the rest of the 25% who has not gone through this stage of violence are also scared, are also in the constant fear and anxiety that we don't know on which day something will come up and it is going to harm us. So it is a lot of mental pressure, emotional stress that a doctor is facing, because when he joined the MBBS course, he was having the perspective that he will be treated as a saint, he will be treated as someone who is going to cure, he will be treated in a humanitarian manner. But now the entire scenario has changed in the past 10 years, unfortunately. Earlier, this was seen in only countries like United States of America and European countries, where the doctors were facing challenges. Around 135 years ago, in US, there is a journal where they have written about the violence against doctors, and they have to face various kinds of problems. The physicians have to face various kinds of problems. And this was not present in the country in past 2 decades, but recently in past 20 years this has increased a lot. And unfortunately, the resident doctors who are working in the emergency, who are seeing the constant high rise of patients, are suffering because of this. and this leads to constant mental and emotional stress.
Right. Dr. Vinay Kumar, talking about how Dr. Krishnan described the stress faced by doctors. आपने एम्स की सेटिंग देखी है जहां पर पूरे देश भर से सबसे कॉम्प्लिकेटेड केसेस टर्मिनल स्टेज पर आते हैं, रेफर होने के लिए आते हैं. तो ऐसी सिचुएशन में पेशेंट एक्सपेक्टेशन कैसे सेट करी जाए, क्योंकि एम्स में ये भी है कि सबसे कॉम्प्लिकेटेड केसेस आ रहे हैं, इतनी तादाद है पेशेंट्स की, तो आप पेशेंट एक्सपेक्टेशन कैसे सेट करते हैं? और सिर्फ पेशेंट की नहीं, पेशेंट की फैमिली भी होती है, पूरा खानदान भी होता है साथ में, तो उसको आप कैसे डील करते हैं?
जी, सभी को नमस्कार. मैं डॉक्टर विनय हूँ और एम्स में रेजिडेंट हूँ, सीनियर रेजिडेंट, और रेजिडेंट डॉक्टर एसोसिएशन का प्रेसिडेंट भी हूँ. और डॉक्टर्स डे पे मैं अपनी ग्रीटिंग्स भी देना चाहता हूँ. सीनियर हैं डॉक्टर शारद अग्रवाल, हमारे कोलीग्स भी हैं. जैसा कि आपने बताया कि एम्स अपने आप में, मतलब सभी जानते हैं, इंडिया का एपेक्स इंस्टीट्यूट है. यहाँ पर हर चीज बहुत अच्छे से प्रोटोकॉल से होती है. जब आप बात करते हैं रेफरल सेंटर की, तो रेफरल सेंटर एक ऐसा सेंटर होता है जहां पर मोस्ट ऑफ द मोडेलिटीज प्रेजेंट हो. पेशेंट जो रेफर होके आता है वो ऑलमोस्ट क्रिटिकल होता है. आई वर्क इन ट्रॉमा सेंटर इन एम्स, तो वहां पर ऐसा पेशेंट भी आता है जो नॉन रिस्पॉन्डर होता है. नॉन रिस्पॉन्डर का मतलब है कि किसी पेशेंट को जा रहा था, एक्सीडेंट हुआ, एक्सीडेंट में उसका ब्लीडिंग इतना ज्यादा हो गया, उसको और कई चोट इतनी आई, जब वो हमारी ईडी में आया, इमरजेंसी में आया, तो उसको जब पहला जो चीज दी जाती है किसी भी पेशेंट को, फ्लूइड दिया जाता है, क्योंकि पेशेंट शॉक में होता है. वो इस पे रिस्पॉन्ड नहीं करता है. रिस्पॉन्ड का मतलब है बीपी उसका पिकअप नहीं होता है, पल्स उसकी फील नहीं होती है. एट दैट टाइम वी हैव टू टेक दैट पेशेंट इमीडिएटली इन ओटी. उस समय हम कोई प्रोटोकॉल या कोई भी चीज फॉलो करने की सिचुएशन में नहीं होते हैं, क्योंकि हमारी प्रायोरिटी होती है पेशेंट की लाइफ बचाना. क्योंकि एक यंग हेल्दी पेशेंट बस रोड पे जा रहा था, उसको किसी ने टक्कर मारी, तो हमारी सिर्फ एक जिम्मेदारी या एक चीज फोकस होती है कि इसकी लाइफ बचाना. इन द मीन टाइम हम एक ऐसा चैनल भी क्रिएटेड रखते हैं, जैसे हमारी ट्रॉमा नर्स कोऑर्डिनेटर्स होती हैं, हमारे जो जूनियर रेजिडेंट डॉक्टर्स होते हैं, और भी फैकल्टीज होती हैं, वो पेशेंट के अटेंडेंट, अगर वो अटेंडेड है तो उससे बात करते हैं और ये बताते हैं कि पेशेंट आपका बहुत क्रिटिकल है, इतना क्रिटिकल है कि ये लगभग मर चुका है. इसको बचाने के लिए हम इमीडिएट सर्जरी कर रहे हैं, जिसमें आपकी भी परमिशन हमने सिर्फ ओरली ले ली है. तो उस सिचुएशन में पेशेंट की एक्सपेक्टेशन को सेट करना ये जरूरी होता है कि पेशेंट एकदम वो कह रहा है कि घर से खा के निकला और अब मरने वाला है, तो उसमें एक प्रॉपर काउंसलिंग देकर हम कहीं ना कहीं उस सीन को बताते हैं और उनकी जो एक्सपेक्टेशन है कि बच जाएगा उसको भी इंश्योर करते हैं. अब नॉन ट्रॉमा की अगर हम बात करें, कोई पेशेंट पेरिफेरी से रेफर होकर आया, तो एम्स में आया, देखिए कोई भी डॉक्टर इनकम्पिटेंट नहीं है, वो कहीं से भी रेफर होकर आया, चाहे वो पीएचसी सीएससी से आया है, किसी मेडिकल कॉलेज से आया है, या कहीं से भी आया, डॉक्टर इन नो वे एट दैट प्लेस इज इनकम्पिटेंट. इट इज ओनली द लॉजिस्टिक इशू, द मशीन्स, द इंफ्रास्ट्रक्चर, वो डिफरेंट है एम्स में, वो प्रेजेंट है एम्स में, जो शायद वहां नहीं था, इसलिए वो यहाँ आया. दूसरा, जो डॉक्टर हैं उन्होंने पढ़ाई की है, बट कुछ चीजें एक्सपीरियंस से आती हैं. एम्स में हमेशा ही क्रिटिकल केस आते हैं, रेफर्ड केस आते हैं, तो एम्स के डॉक्टर को नो डाउट एक्सपीरियंस होना स्वाभाविक है. एम्स एक एपेक्स रिसर्च इंस्टीट्यूट भी है, तो एम्स के डॉक्टर उस रिसर्च को बहुत डे टू डे लाइफ में कोलैबोरेट करते हैं ट्रीटमेंट में, इसलिए एम्स एक एपेक्स इंस्टीट्यूट बन जाता है. उस समय पेशेंट को ये बताना, जैसे डॉक्टर रोहन कृष्णन ने कहा कि डॉक्टर भगवान नहीं है, डॉक्टर इंसान है, बट यहाँ का डॉक्टर आपकी और आपकी बीमारी को उतने ही सीरियस ढंग से देखता है जितना आप समझते हो. पेशेंट की हम पूरी मदद करते हैं, पूरा इलाज करते हैं, और उनके जो एक एक्सपेक्टेशन है, नो डाउट बहुत बड़ी एक्सपेक्टेशन लेकर आते हैं कि हम एम्स आ गए. मतलब कहा भी जाता है कि अगर कोई पेरिफेरी का डॉक्टर है, वो बोलता है कि अब बहुत ज्यादा उम्मीद नहीं है, तो वो एक कहते हैं कि एक बार एम्स में और दिखा लेते हैं. ऐसी एक्सपेक्टेशन है लोगों में, और उस एक्सपेक्टेशन को फुलफिल करने के लिए एम्स का पर से डॉक्टर, रेजिडेंट डॉक्टर, सीनियर फैकल्टी, हमारे नर्सिंग स्टाफ उस पूरी उसकी उम्मीद को बचाए रखते हैं और मेहनत करते हैं. तो एक्सपेक्टेशन किसी की कुछ भी हो सकती है, वो हम नहीं करते हैं, लेकिन हाँ, उस एक्सपेक्टेशन को बचाने के लिए, उसकी उम्मीद को जिंदा रखने के लिए दिन रात काम करते हैं. और हमारे पास सारे इंफ्रास्ट्रक्चर है, हमारे पास सारी मशीन्स हैं, कुछ भी चीज है वो कर कर उस मरीज का ट्रीटमेंट देने की कोशिश करें.
राइट. लेट अस टॉक अबाउट इट्स प्रिवेंशन कि अब इसका व्हाट कैन वी डू, इसका क्या कर सकते हैं. सो डॉक्टर माथुर, माय नेक्स्ट क्वेश्चन इज what measures can be taken at different levels to prevent such incidents of violence, and especially what role can healthcare organizations play in protecting their own doctors?
Hi Ananya, good evening, and thank you for having me here today. First of all, I'd like to begin with sending my regards to Dr. SHARAD AGARWAL. Hello sir, and happy Doctor's Day to you and my esteemed colleagues Dr. Rohan and Dr. Vinay, and to every doctor who is listening to this today. So as my esteemed colleagues have already remarked that violence is a problem that we have established as a problem right now in this country. It wasn't there, as Dr. Rohan remarked 10 years ago, but it is prevalent right now, and it is only rising as we see it every day. When we talk about the measures to combat this, it has to be a multifaceted approach. It has to encompass various stages of patient care. As Dr. Vinay said, that whenever there is a patient who is given a poor prognostication from a peripheral center that the patient might not live or might not survive, and then they come to AIIMS in the hopes that AIIMS could be their last resort. So that is where it should begin. That is what we call as a preemptive method of combating violence, when you have to tell the relatives, prognosticate the relatives, make them realize that the situation is really grave, and they have to be mentally prepared for the eventuality in case it does. So it has to be a preemptive approach first, which has to start even before the patient encounters the first specialist in a large tertiary care center or any emergency, when they come to it. So a preemptive approach followed by increased and robust security measures at the level of hospital facilities. Recently we have seen that to deter violence, when you go to a high-end restaurant or a pub or a bar these days, bouncers are deployed there not just to not to physically harm you, but they are there to deter the instigation of violence per se. So if I see somebody, a police personnel or some law professional or some marshal being deployed in a casualty, even if I have the intent or the urge to create a scene in the casualty, or to channelize my anger there, I would think better, I would think twice. And moreover, this has to be supplemented by strict enforcement of laws and regulations against such violence, and the acts of violence against healthcare professionals. As Dr. SHARAD AGARWAL also said that hospitals should be declared a safe zone. They've been fighting for it. We all have been fighting for it. We all have been fighting for a Central Healthcare Protection Act. We want the government to implement it so that there is a higher degree of penalty or a higher degree of punishment for any such acts. It is only then that the public can realize that they shouldn't take this road. They should know better, and they should establish some every hospital should that is as organizations, what we do is we get in touch with the authorities. We help them frame certain guidelines and certain proactive measures to combat violence if it was to occur in their institute, and this could include anywhere from spreading general awareness in the public, pasting posters in the casualty or areas which have a very high degree of patient footfall, making them see videos on a loop on a television screen, that which is what every other every other colleague has just enforced, that doctors are not gods. They are trying their best, but sometimes the god's wishes might just prevail. And this is what we call as improved communication and education of the general masses. We have to reach out to the general public. We have to make them realize that this is not the way to go. This only puts them a step back when they're receiving patient care. It doesn't help their case at all. And apart from these collaborative efforts, we feel that improved CCTV surveillance, panic buttons in the casualty, or where say for example in obs and gynae, with the department which deals with all the illnesses related to females, pregnancy related illnesses, gynecological related illnesses, there should be a panic button installed. We have one installed in our hospital, because those are being the female sex, they are not really mentally or even physically prepared to even defend themselves, in cases of violence. And we conduct regular training sessions, counseling sessions of doctors and residents, that how they should, if a situation was to arise, how they should proactively try to de-escalate it just by advocacy and dialogue, and not physically harming somebody, not verbally abusing anybody. And also we urge our seniors to create a supportive work environment for the juniors, because if a doctor is also stressed, because as Dr. Sharad mentioned, that we are doing duties of 36 to 48 hours at a stretch with no breaks in between, and no hopes of a even a proper 1 hour lunch break. So all of this piles up mentally, and a patient, a doctor can in a spite of a moment give away to his instincts, and maybe he can shout on a patient. He might not treat the patient in the way that he otherwise would. So encouraging a healthy workplace environment for these residents, these first responders, is also something which we advocate through our organizations. We, as I said, we help develop protocols in every major institute whenever there is an incident of violence, and how to combat it. We have been working very closely with the authorities to make it a crime of the degree that whenever you assault a doctor verbally or physically, there is an institutional FIR that is filed against you within the first 24 hours, so that you don't go easy. And moreover, CCTV surveillance helps helps them nab the criminals or identify them at least. Right. So, and of course, media has something which has been very, very pivotal in our endeavors to combat this issue. We have been collaborating with media outlets such as yours and other reputed media outlets, and we are trying to outreach. We are trying to make the general public understand that this is not the way to go. We are trying to make them understand what Dr. Rohan and Dr. Vinay have already mentioned, that we are not gods, and we try our best with whatever resources we have, be it any institute, be it AIIMS, be it Maulana Azad, be it RMN hospital, or any other primary healthcare center in a long distant periphery. So it is basically an approach which is multifaceted, has to be really thought about. There has to be a lot of dialogue and a lot of counselings which have to be involved, both at the level of doctors and the patients. And then, of course, you have to try and make it, symbolic of a crime, because it is a crime.
Right.
So
it is
that
indeed
is what we
crime.
stand for. Yeah.
Right. Now, I have two questions. One at the level of the policy framework, and the other one, as you spoke about, de-escalation. What would a personal live situation look like, and how can a doctor de-escalate if they have such a situation? So my first question to you, Dr. Agarwal, as the president of AIIMS, how do you think such medical associations should be used for policy advocacy with the government to prevent such unacceptable cases of violence? And what are some of the efforts that are underway, and what do you think more needs to be done by the government in this regard?
Definitely, as I mentioned in my opening remark, government needs to be more sensitive towards the health of nation. If they put more efforts, because as I mentioned, if the violence is continuing there, so I fear that there will be a situation when in the private setup, the doctors will be referring the emergencies to the government hospital because of the fear of violence. And in a country where more than 78% healthcare is in the hand of private sector, and where the more than 75% people reside in a rural area, so you can understand the situation when the private sector, they will stop taking care of the emergency or the critical care patient. So whether the government has that much of infrastructure and the manpower to handle if the private sector start refusing that? So it is not a question that what the IMA is doing or what the other small associations are contributing, but it is a question of understanding the situation. See, violence cannot be understood. Violence cannot be acceptable in any situation. Be it is with the doctors or be it anyone, even in your colleague or in any profession. How can violence be acceptable? Violence is it is a crime. So why we are accepting that? Why government is not making a law? Because I tell you, in the parliament, one leader raised a question for the violence against doctor, and there was a bill prepared. Bill was already ready to present in the parliament by the government, but somebody has given them advice that if we bring the bill against the violence for the doctors, then other profession will also come to make a bill for them also. Is it what the mockery they are making for the medical profession? See, what the mockery they are making of the medical profession. Is the medical profession is equivalent to the other profession? Is there any other profession who works 24/7 for 365 days with the same intensity and the same severity and dealing with the body? See, no other profession we cannot be compared with any other profession, because in each and every profession other than medical profession, you have a second chance. You can rectify your mistakes. You can rectify your decisions. But in medical profession, you have to take in a fraction of second, you have to take the decision. So right. Medical profession cannot be compared with any other situation, any other profession. So a central act is a must, and we are committed for that, and we are pursuing with the government continuously. We had a talk with the health minister also, and we will get it for our doctors fraternity and our student, for our JDN doctors. It is a necessity for that. So that is what we are doing at the act level. But at the same time, we have just decided last week that we will start some training of our, we have 4 lakh members, and we have more than 1 lakh associate members through our medical student network and junior doctor network. So the biggest association of the world, and we have 1700 branches across the country. So we are planning to have a sensitization program of the members through our branches for the communication skill, as Dr. Aviral said, and very rightly, because we have to improve the communication skill. But at the same time, you cannot expect for a poor doctor who is doing 48-hour duty in a medical college, in a government hospital, who hardly have a time to take care of the patient. How will he communicate? So government should appoint some social worker or some socio-medical worker along with the doctor who take care of the communication, particularly in government setup. Because in government setup, it is not practically possible for the doctor to treat the patient and to communicate with the attendant also. It is impractical. If you go and see the setup of any emergency of any government hospital, be it AIIMS or RML or any GTB, any hospital, you go and see the condition of emergency, and it is same in 24 hours. So there should be a training to the socio-medical activist or socio-medical worker who will play the role of a coordinator for appraising the situation to the attendants. But definitely in private hospital, we can do this because the load is not that much as in the government hospital, that we can improve the communication skill. Yes, that is a need. We have to improve, and see, we always believe. See, you have given the tag of God. We have not come to say as God. You have given the status of God to the doctor out of the respect, because the doctors are the only one who you think that gives you life. Though we never claim that we have given the life. We are just doing our job for which we have been trained. We have never asked this designation from anyone. But this is This came out of respect to the doctors. So if you give that, then society should mean it. And doctors are doctors, they are not insurer. They have to, society has to understand.
Right.
Doctor are not insurer. That it is not guaranteed, that destiny is not in our hand. There is a destiny. If the situation is that doctor can give life to each and everyone, no doctor will die in country. So life and death is not in our hand. Only thing we can do, we can give our best effort. We can give our best training to the patient. Right. But we are not insurer. Please try to understand. Right. We are, see, whatever needs to do at our end, we are continuously doing. But what we needs your support is to do a sensitization of the society. The society need to understand that this is not a service. They are not getting service against the payment. This is something else. There is a doctor-patient relationship which needs to be improved, which has been distorted in last 2 decades. And many contribution wise, please don't mind, many contribution wise was for getting the sensitization of the news. Whenever there is an incident, we never do our root cause analysis, we never do our researches, whether that incident has been done by a trained, qualified doctor or in India, there are a lot of quacks are practicing with the name of doctor. And if something wrong happened in the village and rural area, the news comes that doctor has done this thing without checking whether that gentleman is a doctor or not doctor. But everything wrong thing comes on our heading. And that impact the mindset of the society towards the medical profession. So in that we need your help. When that we need your help. Your means the media help. Media should be playing a more sensitive role towards the medical profession. Believe me, these doctors have saved you. Because of these doctors, the India has been appraised worldwide for the COVID management. It is not the bureaucrats who did the COVID management. It is you, police professional, the Safai Karamchari and the doctors and the healthcare workers who worked during COVID. None other. Because of their effort, the COVID management of India was appraised worldwide. So please respect the medical profession. Stop violence on the doctors and the healthcare worker. Please understand the situation. Indian doctors are still the best doctor in the world. There is a huge demand of the doctors across the globe who has passed from India. And that is why you are getting the maximum medical tourism in India.
Absolutely.
From the neighboring country, the patients are coming for India because we have the best treatment. And with this 10% less...
Times of India का ये जो initiative भी है, जो digital conclave. In fact, when I saw this topic, violence against doctors, I think this is the kind of positive journalism that groups like Times of India are doing, that on National Doctors Day, they're not pasting the rosy picture.
Because there are very few journalists who have a good background, educational backgrounds, as you have. So I must compliment your efforts.
Thank you. Last question to you, Dr. Krishnan. Talking about what can be done, are there any international best practices, good best practices? Dr. SHARAD AGARWAL spoke about training social activists, spoke about the role of media. What more can doctors themselves do, healthcare organizations? What is your final message in terms of what to do about it, besides, of course, the role that government has to play in this?
See, I have to tell you that this has to be a holistic approach where each and everyone has to enable themselves and do something about it. Because healthcare is something which is of a social cause and which has to be taken not just as one perspective, but in all directions. So firstly, if you talk about international practices, which I have seen, which is much better than India, which we should adopt, good things we should adopt from everyone. One is the financial anxiety is not there in international practices because the government has taken care of the insurance, and if you go to a private sector or in a government sector, the financial anxiety is not there because it is already being taken care of by the government. Secondly, one major issue which I have seen in our medical colleges, especially Maulana Azad and all the government colleges, is that of overcrowding. You see that if we work in UK, we see maximum 6 to 8 patients in a span time of 8 hours. But in India, I think within 8 hours, if we sit in OPD, we have to see more than 300 patients. So this gives you only 2 minutes to examine the patient, listen to his cause, write the investigations, write the treatment, explain everything to him. So obviously there is a piece of the patient where he is not that much satisfied that he should be. So this is something which we have to think upon. Another issue is obviously the media sensationalization of any such occurrence of violence against doctors. That has to be taken care of, because you see, media usually anchors the society. It tells us which is correct, which is not, where the society is heading. That basic responsibility comes to the media. That is why it is now considered one of the pillars of democracy. I think that it is the biggest title that anyone can get in the world. So I think that the responsibility of media is very important in any such case, that wherever there is some kind of violence, you go to that place and you sensationalize the news so that people are aware of what is right and what is wrong. I think that it is one of the very important causes. Speaking on the perspective of organizations, what doctors can do, what healthcare activists and any educated person should do, I think that another important factor is that we have seen in COVID that even countries like US and UK, there was a collapse in the healthcare sector. So we have to understand that no country can give treatment to 135 crores of patients. So we have to work in a premodulative way, where we don't have a lot of diseases, where we don't have a lot of patients. So for that, we have to improve our basic sanitation, our nutritious value. We have to focus upon immunization. We have to focus upon control of tuberculosis. We have to focus upon female sanitation. We have to focus upon the entire aspects of the primordial prevention of diseases. And this will lead to a better healthcare sector in the nation finally. Another big problem that I like to quickly wrap up with, a big problem which is present only in India, is that of political goons. You see, if you see globally, in a hospital, only one patient and one attendant is allowed. But in India, a hospital, especially a government hospital, there is no one to stop you. You can go there with arms and ammunition. There is no security check. Even if you want to go to a railway station, there you have to purchase a platform ticket. You have to go to a security check, and you have to follow the protocols. But what happens in India is that any local goons, any local political people, they want to ascertain their authoritativeness towards the doctors, and even if they don't have anything to do with the patient. Many a times, I'm an orthopedic surgeon, I've seen that patients, a lot of political goons will come and they'll say that do this and do that. And when we ask that the patient needs blood, we need 2 of you to donate a blood, they are not ready to give 350 ml of blood to the patient. So this is something that that social awareness should be there, that you treat everyone with respect, and you are getting a treatment over here. So a mental stability of a doctor is of utmost importance, because he's the one who's going to operate on you. He's the one who's going to take the major calls. When no one can think best for you, he has to choose the best for you, even if you have abused that doctor. So I think that a lack of social awareness is a major problem which is happening in India, which we must have to focus upon. Another main factor, recently in China, there was a 20-year-old patient who murdered a dentist 6 months after his cosmetic surgery, because he thought that he has not got a proper treatment and proper cure. So we have to understand that majority of these violence cases, they are not just heat of the moment. They are
Right.
sometimes a cold-blooded, well-planned attempts to harass the doctors. Your patient will go, and then after a few days he'll come back and he'll slam you. So I think that we need a very important and stringent law against that. That should be there. Thank you so much.
We will wrap up with the
Just
final
a
takeaway from
second.
Dr.
Sorry.
Mathur.
Sorry
Dr.
to interrupt, Dr. Ananya.
Yes.
Actually, in addition to all the points that have been discussed, there is just one detail that I want to add. If you look at, if you happen to look at the curriculum of the pre-med school in the state of Texas in US, you'll find that there are modules which are integrated into the curriculum against, this very thing that we're discussing, against combating the violence at workplace, in hospitals, and how to effectively manage them. So they begin early. They're training their doctors in the pre-med school regarding this burning issue in their country, and specifically in the state of Texas. If I might remind you, the state of Texas is infamous for its cowboys. So they're doing it at the very basic fabric of medical education. So what we can do is we can derive this and integrate this into our curriculum as well. And also, one thing which we all tend to miss is that we need to spread awareness amongst our medical professionals also. We have to encourage them to come forward to report the incidents of violence if they have faced any in their workplace, because most of the times what I see is that somebody who is so junior in the chain is just plain simply hesitant. He feels that if he comes forward, many questions will be asked, he'll be held responsible, and he doesn't want all that fuss in his life. So we should have a grievance redressal system wherein they can come forward and they can be provided with the necessary psychological and also possible legal support. So these are two things that I wanted to add to this. Thank you.
Very, very valid, and I think that brings us to a good conclusion to this session. Going back to the basic fabric, which is medical curriculum itself. So with that, let us aspire to generate meaningful dialogue. As you saw, an attempt's been made here to raise awareness and collaborate on actionable solutions that can help create a safer and more supportive environment for our dedicated doctors. Here is wishing that we can work collectively towards a future where every doctor feels secure, valued, and empowered to provide the best possible care to their patients. Thank you so much.